Motion to approve.
Second.
Thank you. All those in favor? Aye.
Aye.
Minutes approved. The next item on the agenda is the Tobacco Control Monthly Report submitted by Caesar, Program Director. Caesar?
Good evening. You have before you tonight 3 establishments for a tobacco permit suspension hearing. These stem from compliance checks conducted in September, on September 12th and September 18th. For that matter, before you, there's pictures of the female 18-year-old that was used during those compliance checks. And she was not challenged at any of these stores. She was able to get in with either a $20 bill or a couple of $10 bills, and she was able to get the product without being challenged, without being asked for ID or anything else. The fifth establishment before you is Economart, located at 1280 Lawrence Street, Lowell. Mrs. Samir Patel is here to address the board, but before he does, I'd like to make a few comments. This is a pack of cigarette that was purchased at that location for $13.50 at 12:15 p.m. Like I said, this young woman was able to go in, ask for the product, and purchase it without any challenge whatsoever. There's previous violations at this location, mostly signage violations in 2021, 2013, 2011. And then in 2007, there was a first sale of tobacco to a minor. Back then, the regulation was a $100 fine, so he got a $100 fine, paid it. But then subsequent to this last compliance checks that we did, DOR did an inspection at that location, found untaxed cigars and vaping products, seized those products. This was done on October 2nd, this past month. So this is a first offense. My recommendation is that it's, by the way, he was issued a fine of $1,000. He paid the fine. And my recommendation is that that a 3-day suspension is applied in this case. Mr. Samir is here to address the board. Mr. Samir, you may just address the board if you want.
He can stay there. Yeah.
Good evening, everyone.
Could you just give your name and address?
Samir Patel. My home address or the store address?
Either one is fine.
1280 Lawrence Street, Lowell, Mass.
Thank you.
752. Well, thank you for giving me opportunity to speak. I want to start by acknowledging seriousness of the recent violation at my store. Selling cigarettes to a minor was unacceptable. And I take full responsibility. There was a mistake. Since I have taken an immediate steps, like training my staff, implementing the stricter ID, checking procedures. So, and this store is my livelihood, and suspension of the license would impact my business very much. So we're facing economic hardship right now, rising cost and challenges of maintaining small businesses. So, and also my family member was dealing with a serious illness, and following week, he just passed away. So there was a lot of things that was going on. So today, I'm respectfully considering, I want you guys to consider these circumstances and the measures I have implemented. I understand the importance of upholding the law. I fully committed preventing any further issues. I'm asking the board for leniency for the chance to keep my license, not suspended, and that would help me. Thank you for your time and considering my request. And I assure you that I'm committed to follow all laws and doing my part to prevent underage access to tobacco. I hope for the chance to prove my commitment and compliance moving forward. Thank you.
Thank you, Mr. Patel. Were you the owner of Economart in the years during the previous violations, 2011, 2013, to the DOR violation in October? Were you the owner of Economart in 2011, 2013, 2017, the dates of the previous violation? You were, okay. You do understand we don't have, like, according to the regulation, we don't really have any leeway. We could do, I guess, potentially more than 3 days, but the regulation says 3 days suspension of the sale of tobacco products. We do appreciate you coming here and, again, acknowledging the error and that you've done education with your staff. And because your previous violations were not in the last few years in terms of the city, you had violations in previous years when you were the owner, and you also had a violation from the Department of Revenue around the cigars. You understand that?
Yes, I do.
Okay. We have a motion?
I have a question though. So what, can you explain what the seized untaxed cigars, like what, so that was after this initial violation was in September and then that happened in October. So that was after you already kind of saw Cesar. So what happened with that? I guess, Cesar, like what does that mean? Like are they like
So you're asking me?
little cigars? Like what's the untaxed?
I don't know, because the OR is not specific on the letter about that, but basically what it says is they found cigars for which, the establishment had not paid any taxes on. Also, vaping products for which he had not paid taxes on. So he received a warning from DOR. If there's another occurrence, they're going to suspend his license for 30 or 90 days, depending on the circumstances. Before you make a motion, I just want to say that, I would recommend that a suspension begins on November 19th. It's a Tuesday, because this next Monday is a holiday. I just want enough time for the correspondence to get to them.
Okay. Do we have a motion? Suspension
Motion to suspend
For 3 days,
for 3
consecutive
days.
days.
beginning November 19th. Mr. Patel, I hope you understand the seriousness of the repeat offenses and the Department of Revenue violation along with this violation. We appreciate that this is your livelihood, which I guess should make it even more important for you to ensure that you're not selling, you don't continue to have violations.
We definitely make sure,
Yeah.
Madam Chair, we need a vote call.
I just didn't hear the second on the motion.
Oh, I second.
Okay, and then just a vote, so
Roll call?
Joanne,
Yes?
Erin,
Yes.
Yes.
and Ally.
Thank you. Mr. Patel, you're going to receive a certified letter explaining the rules of the suspension. Basically, you have to remove all tobacco and vaping products from the store, cannot be anywhere in the store on the date the suspension is to begin. I'll be there on that day to put up a sign on the door, but you're going to get a letter explaining all that before then. If you have any questions, give me a call. Thank you.
Thank you.
Thank you.
Next is Manny Liquors, 427 Bridge Street in Lowell. Mr. Neil Patel will be addressing the board in a few minutes. This is the pack of cigarette that was purchased at that location on the 12th of September at 12:19 p.m. For $13.25. He was not asked, the young lady was not asked for ID or anything else. She was able to purchase without any challenge at all. There's previous, just one second. There's previous violations, cigar package violations in 2022, flavored tobacco in 2021, missing manufacturer's letters in 2021, more signage violation in 2014. There was a sale to a minor, October 22nd of 2013, and another signage violation in 2011. So Manny Liquors has been around in the city for many years, and this is the history. My recommendation is the same as with the previous store, a 3-day consecutive business day suspension to begin on the 19th of November. Mr. Anil Patel is here to address the board.
Cesar, is it a typo in the minutes? It says there's a $1,000 fine.
There was a $1,000 fine paid, yes, sorry.
No, that's right.
All 3 establishments paid their fines. The first 2 actually were first violation, there was a first violation within the last 36 months.
7-Eleven.
Yep.
So each receive a $1,000 fine, they pay their fines. The last one is 7-Eleven, it's a second offense, they receive a $2,000 fine and pay that as well.
Mr. Patel, did you wish to address the board?
If you,
If you could just grab that mic, or,
You can go here.
and if you could just say your name and your address? Thank you.
My name is Anil Patel, and my address is 427 Bridge Street, Lowell, Massachusetts. Good evening, everyone. Particularly that day, I said final, and I'm expecting it's extremely sorry. That's my mistake, and I'm the one of the owner and director. That day, same time, the tobacco person is asking for the invoices and everything, like the inspection is going on that time. So I am helping him to find out the invoices, and somehow my mind is not that time, and by mistake I sent the minor. So I am taking the responsibility, and we now want to understand, make sure what is the cause and consequences. So now we're going to take more responsibility, and I told my all employees and owners, we're going to take the also precaution for the asking the items.
okay. And were you the owner in 21 and 22 went for the other violations? Okay. And do we have a motion?
Motion for the 3 days and $1,000 fine.
Second.
Roll call.
Joanne?
Yes?
Erin? Ally?
Yes.
Motion approved, 3-day suspension. Caesar will discuss the particulars with you.
So you received a certified letter with the instructions for the suspension. Just in a nutshell, you're going to have to remove all tobacco and vaping products from the store, taking someplace else. All right? I'll be there on the day of the suspension to put up a sign. Okay?
Have to look.
If you have any questions when you get the letter, just give me a call.
Oh, they're on a second suspension now.
Next is 7-Eleven, located at 970 Gorham Street here in Lowell. Mr. Alan Marcotte is here to address the board in a few minutes. And this is a pack of cigarette that was purchased there on September 18th at 11:33 a.m. for $13.35. This previous violations at this location, the most recent one was a sale to a minor that occurred in January 12th, to be more exact. There's been other violations like, the presence of blunt wraps. There was another FDA sale to a minor that occurred on November 7th, 2019, and there was a presence of a flavored cigar back in 2019. So the person who made the sale is not the same that made the sale in January. 2 different women. And my recommendation is that the tobacco permit at this location be suspended for 7 consecutive business days to begin on November 19th. And Mr. Alan Marcotte is here to address the board.
Hi, my name is Alan Marcotte. The address is 970 Gorham Street, Lowell, Massachusetts. He is right, it is a different person. The prior person that sold earlier this year, I let go. After that, we went through, retrained all of our employees. I probably should have implemented one last thing. Our computer systems at 7-Eleven allows us to make it so prior people could hit OK. It would always ask for an ID. They could hit OK to say that they've seen the ID. We have now since made it, since this last violation, that in order for somebody to buy they actually have to scan an ID. So we can't even, the employees can't even physically hit okay to accept it. So if somebody comes in and tries to buy, no matter what their age is, they have to present an ID, and it has to be an ID that's scannable, so we won't even accept passports or anything like that. I think Paul explained that to you.
He did, yes.
So probably should have done that the first time around. That would have stopped this. Unfortunately, even with the best training, it still comes down to humans to do it. I take full responsibility. They're my employees. At the end of the day, it's all my responsibilities.
Thank you for coming and taking responsibility. That's great to hear that we won't be seeing you again and that they have to scan the ID. But we have to follow the regulation. Do we have a motion to suspend for 7 days beginning November 19th?
I'll make that motion, so 7 days in 2000.
Second.
Joanne?
Yes?
Erin?
Yes.
Ally?
We received a certified letter explaining the rules. You already know them because you went through this in January, but if you have any questions, you can call.
I also have to
Yeah, you are.
Thank you.
You guys all set to go.
Thank you. Do you have anything else, Caesar?
I'll look right.
Oh, yeah.
Yes,
My date is decided or not decided? Which date?
November 19th. Not for tobacco, but we do have a brief discussion on the Kratom proposed regulations. So, you received in your packet a revised version of that proposed regulation. As a matter of fact, if you look at the top of this proposed draft, is draft number 3. I want to point out that you did not see draft number 2, because draft number 2 is the one, included the changes that you decided last meeting. So that's the one that I submitted to the Law Department for review. The Law Department made 7 suggestions for change, and I implemented those. In addition to those, you see the title is now prohibiting the manufacturing, in addition to the rest of the sale and distribution of kratom. The reason I did that is because this regulation, even the first draft already prohibited the manufacturing. It just wasn't in the title. I think it makes sense that the title reflects what the regulation is all about. In addition to the changes that you see tracked in blue, I have a suggestion to make, because I just realized that today. When you look at on first page, section A, the last line, it says, this is all the reasons why you're doing this, you considering this regulation. The Board of Health enacts this, and then it says regulation restricting the sale and distribution of kratom. This is the language that was there for the regulation that was proposing to restrict the sale, not prohibit it. So my recommendation is that we adopt the title, so it'll be enacts this regulation prohibiting the manufacturing, sale, and distribution of kratom. So if you would at least make a motion to change that, I'll incorporate that before we put this forth for a public hearing, if you decide to hold a public hearing.
Okay, so do we have a motion to delete regulation restricting the sale to change to prohibiting the manufacturing, sale, and distribution of kratom?
I'll make that motion.
Second?
Second.
Okay, so does that mean this has to go back to law?
No,
No.
no.
No?
It doesn't, no.
No.
The areas of concern raised by the Law Department, they were pretty good, and I addressed all of them. I received a response from the Law Department saying they were very satisfied with the way I implemented the changes. This is just like a minor thing. It's just to be consistent with what this regulation is proposing. It doesn't change what is prohibiting, what's not prohibiting.
Okay.
Now, are there any questions regarding the changes that I implemented?
Any questions from the board on the changes as mailed?
Basically, it's clearer now, the number of days that they have to appeal, the number of days before a suspension can be implemented once they receive notice. It's always 10 business days now. It's clearer. It's also clear they have 21 days to pay a fine. It's clear that they don't have to pay a fine if they request an appeal before the board. So it's just to make it more readable.
Okay. Do we have a motion? Any other questions?
No. So when can we do the public hearing?
So, Caesar, would the next meeting be appropriate for a public hearing on the regulations?
We could have a public hearing in December. My advice is have a light agenda, because we don't know how busy this place will get with this proposed rec,
Yeah, we don't have a lot of control. Yeah, but,
as much as possible.
yeah.
So that's the December 4th meeting.
Yes.
12/4/24. Do we have a motion to schedule a public hearing on 12/4/24?
Motion to schedule?
Second.
Just a logistical question, is that going to be held here in this room? Okay.
And we will not have Zoom available. We've had a few people call from different states to ask if Zoom would be available. There will not be Zoom available.
Is it also possible to say residents in the city speak first, just to make sure that we're hearing people in the city?
Yes, however the chair would
So we
like
have
to do
to,
it.
well, we have to do the proponents and the opponents in two different groups, so,
Right. We could do people for, do
do the
residents of
proponents
Lowell.
and then the opponents.
We have suggested rules for running the meeting. We have used in the past for tobacco control. The meetings run pretty well organized that fashion. We could use the same one for Clayton if you want.
And just,
Have a script.
right, limit it to 3 minutes each person. Yep.
So we have time to publish the public hearing.
Yes, we'll take care of that from our office, yep.
Yes, there'll be a legal notice in the paper. There'll be a mailing done at least to tobacco retailers, because they are the most obvious interested parties, plus one or more pharmacies that are heard about that they may be selling kratom. So that's minimum. That's what we're going to be doing.
Okay. Thank you.
You're welcome.
Have a good night. The next item on the agenda is the monthly development services report submitted by Matthew Sheehan. Matt?
Good evening, everybody. Madam Chairwoman, members of the board. As you can see from the report that I submitted, a couple of new businesses open up in the city. We had a few fail their health inspections. I think one of the biggest issues that we did have between meetings was that we had another grease leak over at Wendy's, 1460 Middlesex Street. The gentleman to my right is Frank Colford. He's from Wendy's. Just a little bit of background. We had responded out here in June of this year for the same thing. So fines were implemented, a corrective action plan was put in place by our wastewater facilities. And I am happy to say that Trent and his team at Wendy's is working on the implementation plan that was put forth by wastewater. I had originally closed them on October the 15th. They were reopened on October the 18th after they had met significant goals set forth by wastewater. I'll get into the schools after that. So if anybody has any questions for Trent while he's here.
Hi, good evening. I'm Trent Colford. I'm the Director of Operations for this Wendy's here in Lowell, actually the one over on Chelmsford Street as well, too. And we've been doing business in the city for over 20 years here. But I'm more than happy to answer any questions that you may have.
So I'm just curious, so it's happened twice in 6 months or less. What's the remediation and what's the prevention that's been instituted?
Sure. So the remediation has been extensive cleanup of it. We had to go through and clean out the entire storm drain system in that whole property, which is attached to the gas station there. Then we've cambered all of those pipes and all those drainage to know exactly where each one of those are, where they go to, how they affect the city, how they affect the property. Those drawings, the camera film has already gone to the city. Director Bergeron has that information. And our engineers right now are in the process of drawing all those out so that there'll be a physical as-built of that property. The biggest thing for us was after June, we had cambered and cleaned all the drains, we had cleaned the grease trap. But what we found later on in this situation when it happened again was we did not actually go far enough in our cammering, and we discovered that beyond the grease trap, there was a rotted out cast iron pipe that was actually causing the backup again. This time, we've done the complete system, all, I don't know how many feet, very extensive amount of feet, replaced all that cast iron in there. That should not ever happen again. It's been replaced legally with the PVC product that the engineers said we could. And our pumping has gone to once every 12 weeks now, which is much more often than where we were before. So that's what we've done on that side of it. So.
Okay.
I just had one question. So I think that there was a concern that both times that this happened, the restaurant themselves didn't know that this had happened, and the first time it was a business next door that called, and the second time I think it was someone who pulled into the gas station that realized that this had happened. Is the people, I know you're not in the business all the time, are the people on site aware to watch for this now in case something happens? Are they trained?
Yes, we've done extensive retraining of our employee. We've actually changed leadership in that restaurant as well.
Thank you.
So, yeah, hopefully that these steps will definitely take place. As well as myself, district manager, general manager there will be certainly watching a lot closer.
Thank you.
Matt, did you have anything else you wanted to detail about the situation?
No, ma'am, not with Wendy's, no. Like I said, they were given the corrective action plan by wastewater. They are working on that. They made significant strides in that. So on my end, we're happy with Wendy's. Right.
So who ensures that the corrective action plan is completed? The wastewater people or us or the health? Wastewater.
And I also believe that you and the property owner had received a letter from the Environmental Protection or DEP.
Yep.
So I believe there was something, and you had to write a response to them as
Correct.
well. So I believe that there were a couple of agencies involved in this that had corrective action plans as well. So there were a few eyes on this as well.
Yep, correct.
Okay. Thank you. We appreciate you coming tonight.
Thank you.
Thank you very much. Appreciate it. Thank you.
So at the end of the report, you see that there are 5 schools that still in failed status. I can report tonight that the Bartlett passed today. The Washington also passed today. However, that being said, the Laurel Lee is still in a failed status for the same reason. Expired fire extinguisher. The Cardinal O'Connell is still in a failed status for not having a current allergen certification for a person that actually works in the building. And the high school is still in failed status for not having paper towel dispensers at the hand washing sinks. Now, I can say that the high school, that myself and Rick Golden did receive an email today. That should be fixed by Friday. But
I'm confused because at the last meeting when Mr. Underwood was here, he spoke that all of the things on this month's agenda were already taken care of. Okay. I don't understand.
And as you can see that, with today's date, I've been out there to these buildings 3 times.
I can see that.
So 2 of them, 3 of them, another 2 weeks, go back up.
So in terms of the fire extinguishers, I think we had this conversation. I feel like we've had it a number of times. Does the school department contract with someone to come out and ensure that their fire extinguishers are up to date or working?
Mr. Underwood made a comment at the last meeting that he wanted the janitors to go around and
That's
look
right.
to see. So we need to streamline who is responsible for what, because it seems like the same issues are happening over and over again.
Correct.
And the fact that these schools were even allowed to open with expired fire extinguishers is not acceptable.
Like I made a point at the last meeting, if this were a regular mom and pop restaurant,
They would be closed.
I would shut them, somebody
So-
on my staff would shut them down.
I
Yeah.
mean, what like actions can we take?
So we spoke today about involving the fire department with the fire extinguisher.
No, why do we need to bring in additional parties? Why can't this be solved with the people who are actually responsible for these buildings? Because I feel like the more people we're bringing in, the more places there are for things to go
It's a lot of not it. Not
It's
me.
a lot of
It's
like,
that guy. It's
yeah.
not me.
I mean,
Well, that's
example-
what this is this is like a big circle of,
I mean,
this is-
again, I'm happy
whose
to have the fire
responsibility
department
is
come in
it that
and
we-
make sure
yeah.
that things are
Yeah.
safe. But again, I think we're bringing in people when this is actually not, like, this is something that can easily be checked, as far as I'm concerned.
Myself and one of my team members, we go out, we do the inspection. Any failed items that we find, we enter into school dues. It gets sent to the proper party.
right.
Unfortunately, these were sent out a handful of times, and
But
So say a school has a fire extinguisher that's expired, what do they do? What are they supposed to do in a timely manner?
well, one would think that hopefully it would work. But you go to another room and find another fire extinguisher, I guess.
No, I mean, do
No,
they,
but who are they supposed to report it to?
what are they supposed to get a new fire extinguisher?
Report it to the school staff. So they put it into a log and they send, it's pretty much the same thing that we use, like that software, School Dudes. It goes into, whoever's responsible for the building puts it into that, and then it goes to the proper party to have it fixed or replaced.
They must have some kind of a plan that
But they-
somebody's supposed to come in and look at all the
They
fire
must have a
extinguishers
contract with a
once year.
company or
Correct.
something.
So once a year, someone
'Cause
must
it-
come in and look at all the fire extinguishers like they do in the hospital.
So-
They come in and
yeah.
look at all the fire extinguishers.
Because I thought it was the fire department's responsibility, but then I learned it wasn't. And then we were told that the janitor, the custodians were going to ensure that the fire extinguishers were, but they must have a contract with a fire extinguishing company.
But do you remember 2 years ago when Rick Underwood was here and then they had the Ansel system wasn't up to date and it was like, well, that's Airmark, but Airmark doesn't have the money, like they don't have the checkbook to do it, that's the school system. And it's like rinse, wash, repeat. We're in like the same cycle.
And you wonder why the city has been trying to join with school management of the facilities of it's just,
Right, who replaced all the other fire extinguishers that must have expired at the same
Yeah.
time?
It's the same company that does the city.
That does what?
It's the same company that does all the buildings. So to your point of like a schedule, I mean, and I bring everything,
And the fact that this can't be done in the 3 months or 2 months, essentially, that school is not in session, I do not understand how there is not a checklist of sorts where each school has to be checked. Dun, 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 dun.
Which school was this? Which school was it?
this is the Laura
we're
Lee.
really on power.
So I don't think that school had any, was that school having any renovations this summer?
I don't think so. I'm not, not that I've seen.
Did it? Because some of the schools weren't accessible for the summer,
Right.
Yeah.
but you would think there'd be more fire extinguishers
The
out
service
there.
But
thing is
the
awesome.
previous inspection, so when they were told in the previous inspection, your fire extinguisher's is expired, they still didn't fix it. When you went back, it still was expired.
And I make it a point in the reports that I send to everybody in the city that I take a picture of it.
Oh, wait, I mean, we believe you that it's,
So, again, I don't have
Yeah.
an answer as to why it happened.
Yeah, and it's, you're just doing the inspection. It's not your job
we're
to
not mad at you.
make sure the fire extinguishers are current. It seems like somebody should take ownership of this, and we seem to be getting different answers. So
what do we do?
I'll make a call tomorrow.
Lisa's going to make a call tomorrow.
we
I'm
need
gonna
to,
reach out, as Director Golden said, I am gonna call fire on that, because it's the third time we've been there, and they should just be, I don't wanna put another person in the mix, but they should be notified anyway.
yeah.
Does
Well,
anyone-
yeah, so I guess the fire department should know that the fire extinguisher at the Laura Lee, in case they arrive on scene ever not, is expired. So I don't have a problem with the fire department being made aware of that, but I think the school department must have a company that is responsible for that.
Yes. It's the same one that we have.
So
It's just,
We will get it fixed.
I have a question about the ServSafe certifications because this
Yes.
seems to come up a lot.
Every year.
So when they do the hiring process for people, which I know this might not be, I mean, it's something you can answer, but if you get hired to work in the kitchen of the schools by Airmark, wouldn't one of your first trainings be the ServSafe? Like, is that something everybody needs, or they just need a number of people with it in the building?
It should be. That, it should, well, like, it should be a prerequisite. You need to, or within, whatever, let's say 2 weeks, a month, you have to get these certifications. Food code regulation requires that whether you cook or serve, doesn't matter. You cook it, you can serve it. The person at the facility, whether has a cafeteria or it's just a satellite, is required by food code to have both serve safe and allergen.
As is reasonable. Okay, so, and so there was a problem where they were just, not having those up to date in several schools.
Correct.
And the person from Aramark assured us that they were getting up to date in their training.
So a class was held for their staff, and for the serve safe, they are up to date. But you need both. It's not one or the other. You need a serve safe and an allergen. So at the Cardinal, the serve safe is up to date, but the allergen is not. And again, I'm not trying to nitpick at all.
Right.
But I expect my team and myself, when we go to restaurants,
Right.
restaurants get hit for the same exact thing.
Right.
So they're no different.
It's the food code. It's not nitpicking. It's the food code. And I think having a fire extinguisher that's not expired and having someone in the kitchen that is certified, serve safe, and allergen is reasonable. So we're not, and we hold those standards to hundreds of restaurants in the city. I just don't understand why we can't get our schools to adhere to it.
Because there's no,
Oversight.
there's no
There's-
punishment.
Right.
They
So
don't-
you close a
nothing.
restaurant, or they, so they follow the rules, because otherwise they get closed.
So what's the,
It's frustrating.
I am hoping that this is all fixed by Friday.
Good to be an optimist.
Yes, ma'am.
But if not, do we bring them all back? Like, we've done that. They've been in front of us.
back?
The Airmark and,
So, do we have any schools on next month's list?
No, this is it.
This is it.
Well, I take that back. So, like I said, 2 weeks. Grace period of 2 weeks, to get
You'll be going back.
taken care of. And we'll go back the week of 20th, just before Thanksgiving. And if everything's fine, there will be no schools on your list for the December 4th meeting. If everything's not,
I just don't know how there are no soap or towels at a hand washing sink. Isn't this the new cafeteria?
it is. So there is soap, like that, they put the soap dispensers up, but they didn't put the paper towel dispensers up, so they didn't have the proper equipment to do it.
Well, this one from 10-1 says there was no soap or towels at the hand
That's
washing.
correct.
That was correct.
Yep.
Yep.
And that's in the brand new,
Brand new cafeteria.
new wing, or the new section of the cab, like where they serve the food. So, but like I said, there is soap.
I don't know what high schooler is gonna wanna wash their hands with soap and then not dry them. That's kind of, and then eat food. It's kind of gross.
It's frustrating. Okay, so I guess the question is, in the interim, would you let the director know whether these schools before the next meeting have passed? And if they have not, then we need to invite someone again from the school department.
So if there are any failed schools on the next list, whoever is responsible for that, we will invite them to the December meeting.
Okay.
Okay?
Yeah, absolutely.
Yeah.
And when Matt and his team do inspections, they send an email. If whoever's on the list, he will send the email and say they have passed or they're still failed. So we have communication.
Thank you.
Again, like Ally said, it's it's a lot of like passing of who's responsible for something. Just make someone responsible for ensuring that we have non-expired fire extinguishers in our schools, period. It doesn't seem like a complicated thing to me, anyways. Thank you. I think I had a question on, Does anyone have any other questions on the report? So, Cha Time on University Ave, they failed previous inspections for the same violations.
Yes.
So are they set up for more frequent inspections, or? Okay.
Yeah, so instead of every 6 months, that area inspector will go every other month maybe, or I wouldn't say once a week, but they'll pop in there.
Yeah.
Frequently.
Okay. There were a couple schools that seemed like they needed catch-up, like the Malloy was done December of 2023, but not again till October 8th of 2024.
I think that's just because of, I think it was logged wrong, number one, and just the movement of staff and things like that.
Okay.
Because if you went 6 months out, it was June, and towards the end of the year, we really don't go in there, and especially in the summertime. We want to see, like, all the schools, like the kitchens and action.
Yeah, because it looks like the Wang was listed as October of 2023, and then not till October of 2024.
Like I said, I think that's just a typo, because, especially with the schools, it's literally to the T.
It's every 6 months, yeah.
And you had been in the Pawtucket, so I can't picture that you weren't in the,
No, one would.
in the Wang.
Yeah, we're
So,
gonna,
yeah.
like, we try to, like, when it's myself and my colleague, we'll stay in that area. Get them all done at the same time.
Right.
Instead of having to go.
Did Mr. Murphy retire?
Yes, ma'am.
Oh,
Yeah, in July 1.
oh,
Other day, July 1.
He went at the same time as Jimmy went. So that's why they lost two. Yeah, they lost two in the office at the same time.
Every time I walk in, everybody says, "Where's the old guy?" And well, I think I smile a lot more than the old guy. Apparently I don't. but I'm working on it.
okay, any other questions? No? Thank you, thank you. The next item on the agenda is the Pride Star Trinity report. We have the overdose report first. Any questions on the overdose report? Okay. Numbers are down.
I'm sorry?
The number was down for last month on overdoses.
It's down. For October, it's down too. So we have the October month. We just finished it today. It was 19 overdoses and 11 of the priority one. And we haven't seen those numbers since March of 2014.
Wow.
And it's not just Lowell, like all of our service area. We've seen a massive reduction in the opiate-related calls.
That's awesome. Okay. So on the agenda is the 2024 third quarter report.
So, kind of right, it's broken into the two parts. There's the old historic report that's in there, and then the new one. You know, as you kind of flip through it, really nothing kind of jumps out at you. It's kind of where we've been for a very long time. The only difference I wanted to call up is on page 9. It's, we put a list of our employees to hire. We've been able to hire a lot more employees lately. Speaking with Dave Green, we do 6 EMT classes a year. Before the pandemic, every one of them was full. We had no open seats. We had a waiting list. Since the pandemic, that has not been the case. But the last, we did a class this summer, and it was the first one we actually had a waiting list for.
Yay.
So we've been able to hire and onboard a lot more people. There were quarters, if you think back to 2022, where we were hiring like one person. And now there's, you know, I think that's 17 or 18 that we're able to onboard, which, you know, allows us better coverage. It allows us to do better work for the hospitals as well, right? So when we don't have enough ambulances, we pull back from assisting the SNFs as much, helping the hospitals, which then impacts the whole healthcare system, really. Again, on the old 911, that's, again, pretty average numbers. Nothing really jumps out to me anyways. The new numbers, this is the second month that we've been able to kind of break it down into on-contract and off-contract that we've been talking about for a little bit. So that starts at page 20. You know, like we talked last time, we spent some money with a developer to get an Excel program that could go back and count the calls, and we could try to figure out, you know, how often we needed a fourth truck, how often we needed a fifth truck, and how that impacted response times. So this is the second quarter we've used it, so we felt a lot more comfortable about it. It's not the easiest process. It takes like an entire 2 days to just run these 2 pages, because it's a lot.
And you're not just running them for the board, right? Or are
We
you?
do, sure,
You are?
absolutely. Yeah, we don't use this anywhere else other than the board, but it's okay, like, we have to answer for our actions, and if this is the way that the city can have confidence in Lowell General and us doing our jobs, like, it's an important 2 days. It
Well,
is. But-
we could, so I guess we could talk to Dr. Galvin when he's here next, and I'm just not sure, is there some way to tweak the report, or, I don't know, I'm just not sure.
But it looks like,
What-
aren't the numbers like just at 89 or like 90? So like with the 5th and 6th, like without taking them out, weren't we running it like kind of just below where we were supposed to be? So when you
Right,
take
so-
the numbers out, you can more clearly see like you're running at the amount or more, right?
Absolutely, yeah, so, right, when we consider the first, second, third, 11th 911 call, we were at that 88, somewhere between 88 and 86.
Yeah, right.
Which is why we took the steps to break out, like, okay, the on-contract versus everything else. We talked about it last time, like, for a little bit, for I think it was probably the next year, like, let's do both. Let's make sure the board's comfortable with the transition to the new one.
It's not forever.
Yeah, please, no, yes, yeah. We would prefer it not to be forever. And
Right.
Joanne, I do apologize. So, for a long time, we've had a conversation now and again about the distance. And the other day, it finally occurred to me to make a visualization of what we were describing. And it was one of those, like Don and Marblehead, and I was like, I don't know why I didn't do this forever ago. And we could really do the same example for every reason, if you will. So we have a system called Genesis Pulse. Every ambulance, whether it's the hospital medic trucks or ours, we know the location of every truck every 10 seconds. And it gets recorded into this system. And Genesis Pulse allows us to go back in time and look, so at a specific call, or if Lisa called and said, hey, we want to know where, on January 3rd at 2:30 in the afternoon, where every truck was. This system records the location of every ambulance every 10 seconds, and we can replay it. Yeah, it's really a great system. So we use that to kind of show the distance. So
Okay.
here's a call that we put into the system as distance. It was the 4th 911 request. So you can see kind of the little triangle-y looking things over by Lowell General. I apologize for the font, but it says A16AD. So that's ambulance 16. They're at the hospital, so they were on a 911 call, right? So the patient's still on the stretcher, so that counts as call 1. And then over at Saints, there's 2 ambulances. You can see 2 of those little triangles. There was A40 and A44. Okay, so that's 2 more ambulances. So that would be the 2nd and 3rd call for the city. There was actually a 5th ambulance that was behind these guys because they were having a crew swap, so they were out on Westford Street. But you can see that ambulance 28, they're at Dutton Street. They're at our Dutton Street location. So that was the 4th call for the city. So the dispatcher took 30, 40 seconds to give the call out. The crew, went to the bathroom and jumped in the truck, and it took them a minute to get en route. So if you do out the math, right, we had 6 minutes and 44 seconds to get to the patient. From there to that address, out Willard Street there's no way to do that. So that goes down as that distance. And that was that, we've always kind of gone back and forth, what do we call that? No one did anything wrong. It was just kind of circumstances. So I thought maybe the visualization of what distance is would help.
Very helpful.
Yeah, I apologize. The first time you asked, I should have said, why don't I just do this? And it never occurred to me until.
Well, yeah, it's nice to see an example, and it's nice to see, the number call it is, the 4th call, and then to just get an idea, like, where they're going, how far they actually had to go.
Yeah, so I apologize for making you ask so many times. It just didn't occur to me till the other day, and I was like, why don't we just do this?
Yeah, this is great. Thank you. Okay, any other questions? Anything else?
Nope.
Okay. Great, thank you very much.
Great night.
Have a good night.
Thank you.
The next item on the agenda under old business is note that there's been a withdrawal for consideration for further modification of the current body art regulations. Did you want to say anything
Yes,
about
so this
that?
was for the microblading. So they were here at the last meeting, and then after the last meeting, they sent an email, and they said that the only thing that they wanted to do was change the apprentice, so the piece that you guys had already voted on the last time. So we'll do the public hearing after the Kratom public hearing. We'll probably do their public hearing at the beginning of the year, because you said that it was okay for us to change it anyway.
Right.
And then we'll do a public hearing after. But they changed, and they did not want us to consider, they took what the doctor said to them, and they didn't want to change the rest of the stuff that they were talking about.
Okay.
Okay.
And then the next item is the indoor air quality assessment for the 1920s building at LHS. Looks good. Little dust.
Yes, some dust.
And then the next item on the agenda is the director's report, and I'll turn it over to the director.
So we start with the school health report. So we hired 2 new hearing and vision screeners. So we'll start seeing numbers for the hearing and vision screeners back on here. I'd like to give you a number of how many school nurses we have, but it keeps changing. So maybe next time I'll have a firmer number on that. We had 1 retirement in October, and we'll be having 1 retirement in November. And I think we're done with the leaving, and we have 1 job that just came down, so we have 2 hires, and we have, I think, 5 people that applied. So we'll see where we are from there. Hopefully I'll have firmer numbers with that. And then the public health report, if there's any questions with that. We started the flu, and we did get our COVID vaccine, so we did start giving COVID vaccines, I think, last week. We just have Moderna. I think is it 160 flu shots between the employees, some public clinics, and then retirees.
No TV questions?
No TV questions.
She got it right? Good. And then the report from the Substance Abuse Division, kind of changed how she's doing it to try to make it a little bit better. So how many people they're seeing, how many trainings they're doing, things like that. We are losing one of our grant people. Devin Gilmore is going to work for the state, so we will be posting a job for that.
He's been there for a while, right?
Yes, yeah, I think a couple of years now. Went from co-op to
Okay, yeah.
a little bit of a switch of a job, but yeah.
So on the syringe collection activity,
Yes.
just, there were 1,626 syringes picked up from October 1st to the 29th. Is that right?
1629 in September and 1626 in October.
1,626.
Yep. And then we did, on the next month, you'll have the medication take-back day. There are quite a few that were passed in.
Oh,
Almost like,
Yeah, so-
well,
pretty close.
it's a lot of syringes.
Yeah, we have the 2 syringe coordinators now, so they're, so we have both of them.
Yeah, I mean, we're picking up 500 more each month.
Correct.
Looks like, or if you compare it to some of the months,
Right, yep.
900 more than January and 500 more than, 400 more than
Yeah, they're
February.
both, I think they're trying to outdo each other.
What?
They're trying to outdo each other. I think there's some kind of contest going on here.
It's fine. Okay, anything else?
Yep, I think that's it, unless you have any questions for me.
Any questions for the director? Okay, do we have a motion to adjourn?
Motion to adjourn.
Second?
Thank you.